My name is Sulaiman Mahmoud Ajishe. I'm a trader. I have an accident in Nigeria, in Lagos. Unfortunately, they rushed me to hospital. I was there for a while, for years. Then I came to the Indian. That was 2012. I met Dr. Dipshika. So she now introduced me to my main doctor, Dr. Shetan. So they carried my operation the next day.
Mr. Mohammad Suleiman, 48-year-old gentleman who came to us almost 1.5 to 2 years ago with a badly managed fracture. What we have done is we have fixed his hip joint where it was fixed in a bad way, and the fracture had not united and he was not able to walk. He had a lot of pain in his left hip and he found it extremely difficult to walk. He had a fracture of his hip bone and he also had fracture at 2 places in his thigh bone. You can see here and here. He had already been managed where his thigh bone fractures were led to unite. You can see it is slightly deformed, and when he came to us about 1.5 to 2 years ago, he came to us with a hip fracture which had not yet united. We did a corrective surgery on the left hip where we fixed it with what we call as implants. This is called as a DHS implant. We were able to give proper alignment back, restore the proper angulation, and here you see an X-ray which is 1.5-year-old where it shows complete union, and today he was able to walk completely pain-free, and he is very happy. But then, owing to his poorly managed thigh bone fractures, that is the deformities here and here, he had a very stiff knee. He is not able to bend his knee. Even at the first instance, we told him that we'll have to first attempt to get his hip fracture to unite, and then we'll address his knee joint, where now we have done a quadriceps plasty, that is a soft tissue surgery in order to get back full movement in his knee joint, and we expect him to be having a movement of 0 to about 120-130 degrees in his left knee. Once he had the surgery, he went back to his hometown, that is his Nigeria, and we used to communicate frequently. He used to send me his X-ray pictures. He used to send me the videos of the way he used to walk. I was able to guide him about the kind of exercises, about the kind of rehab that he needs to follow. He's been regularly doing it, and owing to the proper surgery done, owing to the proper rehab followed, he's been able to achieve full union at the fracture site, and he's able to walk comfortably without any pain.
What is my big surprise is, after they did my operation in India, the second day, Dr. Shetanan come and meet me on the bed. That, Sulaiman, I say, sir, you like to walk now? You free? I say, oh, that is impossible. In Nigeria, when I got to the hospital in Nigeria, I was in the bed for more than 6 months without walking. I just been there. So why are you going to tell me that I will wake up in a day and be walking the second day? You make my operation a day, and the following day you tell me to walk. It's impossible. You say, that is Nigerian for me. In Indian, it will be better out of. I say, well, okay, no problem. He give me the 2 crutches to stand up and walk. Then I go to the toilet, I come back. So I don't even believe that I can walk like this. He now tell me that in the next 3 months, I will walk perfectly without using any crutches. He did hip surgery for me and the fame surgery. I mean Dr. Shetan. Then he now tell me that I should go back to Nigeria within 6 weeks and come back again after some weeks. So I will make sure that I walk very fine. Then I do that. This time around today, I was very much happy for my second surgery for the knee cap. So I was in India 2 days ago, and today is on the 13th. I was in India on the 11th, and they carried my operation today because when I met my doctor yesterday, and he now told me that, Sulaiman, I'm still going to do something for you better off again. What I don't even believe that I can do in 2 years, in 5 years, I do it within some months. So thanks to Mr. Shetty, thanks to Mrs. Deepshika. So when I get back home right now, I will continue and tell people, introduce Vikram to them. Thank you, Vikram Hospital.